The following video is an overview of the startup procedure of the Draeger Evita Infinity V500. It is not intended to replace or substitute the instructions for use. There are two components to the V500, the V-box or the ventilation unit on the bottom, the C500 or control panel on top. To power on the ventilator, you press the green button on the lower left-hand corner of the screen. You will get the green light to indicate that the ventilator has been turned on, and the power bar will scroll across the screen to indicate that the ventilator is booting. To connect your circuit to the ventilator, the inspiratory limb of the circuit attaches to the inspiratory valve on the right-hand side of the ventilator box. The expiratory limb of the ventilator circuit connects to the expiratory valve on the left-hand side of the ventilator box. If you lift the door, you'll find the expiratory flow sensor, and your gas flow goes through the expiratory valve to the expiratory flow sensor and out to the atmosphere. If you're going to be putting a filter in line, the filter would go between the ventilator circuit and the expiratory valve. No gas that flows through this system goes into the ventilator box itself. Once the ventilator boots, the user will have the option to select the patient category. You choose from adult, pediatric, or neonatal. Touch the button turns yellow, lights the rotary knob. You press the rotary knob to confirm your selection. By choosing new patient, the ventilator will clear the previous patient data and reset all the ventilation parameters to default. Choosing new patient will also take the user to the standby screen, and this is where you can begin the ventilator setup. The user is prompted to perform a device check and breathing circuit check. This message can be cleared by touching the alarm reset button, lights up the rotary knob, press to confirm the message will be cleared. In the Start Standby window, the user can choose the System Check button. This is where you'll find the pre-use test. The pre-use test is required between patients. Within the System Check window, the first tab you find is an overview of the last test that was performed and the status. This is where you'll also find the tabs to find the device check, which goes through and calibrates all the different components of the ventilator box, as well as the breathing circuit check, where the user can do the breathing circuit check or leak test. To perform the device check, touch the device check button. The user chooses the start button, which will turn yellow, again pressing the rotary knob to confirm, and the user will be prompted with instructions which they'll answer using the buttons saying yes or no. The ventilator will go through each of the different components, and as long as each component passes, the device check is successful. Once the device check has been completed and all the components have passed, the user will be prompted to continue to the breathing circuit check. This process is done the same as pressing the start button and confirming by pressing the rotary knob. The user will then answer the questions on the screen as well. Once both of these components have passed, the user will touch the Start Standby button to return to the standby screen. From the Start Standby window, the user can access ventilation settings by touching the Ventilation Settings button in the lower left-hand corner of the screen or the upper right-hand corner of the screen as well. Touch the button, it will open the dialog box where you'll find your modes of ventilation, your basic ventilation parameters, and all of your additional settings. Your modes of ventilation displayed in the tabs across the top are going to be the modes that are most often used, but by pressing the Other Modes button, it will show you all the modes that the ventilator has. The nomenclature on the V500 includes a prefix for every mode of ventilation: PC to indicate pressure control, VC to indicate volume control, and SPN to indicate spontaneous breathing. Your basic ventilation parameters are displayed under General Settings in the Ventilation Settings dialog box. To make changes to parameters, simply touch the button, dial the parameter with the knob, and confirm by pressing the rotary knob. The new setting will be displayed in the button. If you touch the button, turn the knob and do not press the rotary knob or touch the button again, you'll notice that the user is prompted with the setting not confirmed message on the alarm bar. On the V500, one thing to note is that your inspiratory pressure, which we call P-insp on the V500, is the inspiratory pressure that will be delivered to the patient and includes the PEEP. Therefore, when the ventilator is running, your inspiratory pressure set will match the inspiratory pressure measured. So your basic ventilation parameters sit under general settings. The second page is additional settings, things such as flow trigger and other additional settings. To change your mode of ventilation, simply touch the mode name on the bar and confirm. Notice that the dark teal box moves over to the new mode of ventilation. To exit your ventilation settings screen, simply touch the X in the corner and that will return you back to your start standby when your ventilation parameters are set and you're ready to begin ventilation. To begin ventilation, simply touch the Start Ventilation tab on the control panel and confirm by pressing the rotary knob. While ventilating, the V500 will display the ventilation parameters in the buttons across the bottom of the screen. Any blue value displayed is a measured value. Graphics will be displayed in the center of the screen, and atop the header bar, you'll find your mode of ventilation and any alarm messages to the user. The right-hand columns of the screen are for the shortcut tabs to take you to the functions that are used most often. To make a ventilator change to any of your basic ventilation parameters, we use the touch, turn, confirm method. Touch the button, use the rotary knob to dial in the desired value, and confirm. Touch, turn, confirm. If you do not confirm the value, touch, turn, and you do not confirm, the user will be prompted with a message that says setting not confirmed. Notice that the value has not changed and gone back to what was set originally. You have fast access to your basic ventilation settings across the bottom of the screen. If you want to change your mode of ventilation or any additional parameters that are not displayed on the screen, you simply touch the mode of ventilation displayed at the top of the screen and it opens up that ventilation settings window. To close that window, you simply touch the X. The other way to do this would be by touching the ventilation settings tab on the right-hand side of the screen, and it takes you to that same ventilation settings window. Again, remember, the modes that you use most often will be configured into the tabs. Other modes shows you all of the modes that the ventilator has. Should you have a question about the mode of ventilation or confusion about the nomenclature, any mode that's highlighted, we can use the arrow, and it will give us a description of the mode of ventilation on the control panel, including a picture of graphics and all the associated parameters. The user can choose a mode without affecting the change and still read about that mode of ventilation if you have any question about which mode to choose. Again, just touch the X and it will close out that dialog box and take you back to your main ventilation page. Your screen will swivel in all directions, making it easy to display the screen where it can be seen. And on the front of the ventilation box, you'll see an analyzed FiO2, an exhaled minute ventilation, and a breath-to-breath pressure excursion display. This will allow the user to see a basic ventilation status even when the control panel is not readily visible. To set the alarms, touch the Alarms tab in the upper right-hand corner of the screen. Here you will find all the active alarms for the mode of ventilation. You'll see your patient values in the center, high alarms on the top, low alarms on the bottom. To make changes, use the same touch, turn, confirm procedure. Touch the button, turn with the rotary knob to set the desired value, confirm by pressing the button. Active alarms will be displayed by the audible alarm. You'll get the message in the header bar up at top, and you'll also get a 360-degree alarm notification so you can see that the ventilator is alarming from anywhere, even if you can't see the screen. Your alarm silence is in the lower right-hand corner. To troubleshoot your alarms, it's very simple. Simply touch the message displayed on the screen, the ventilator will give you a listing of all of the active alarms. Highlight any one of them and use the up arrow to get a description of the potential causes and remedies for that alarm. Once the alarm is resolved, the message stays on the screen. If you touch the screen, you will get a button that says Reset All, and that will clear away all messages that are either old messages or alarms that have resolved. To clear the screen, you touch the X, and that will take you back to your main monitoring page. In review, your ventilation settings sit in the buttons across the bottom of the control panel. Anything displayed in blue is measured, anything in green is set. To make a change to your parameters, quick set, touch, turn, confirm to make a change. If you need to get to your mode of ventilation or any additional settings, you can touch the mode of ventilation at the top, or you can touch ventilation settings over on the side. All of your basic ventilation settings that are used most often are displayed in the tabs. Others shows you all of the modes that the ventilator has, and you can touch the X to clear the screen. To set your alarms, you simply touch the alarm button. The ventilator shows you what the patient is doing, high alarms on top, low alarms on bottom, and touch the X to clear the screen. On the far right-hand side of the control panel, you find the shortcut buttons to the functions that are used most often. You have your O2 suction button. If I touch it, it turns yellow. It has to be confirmed by pressing the rotary knob. The O2 suction function will give you an increase in FiO2 to 100% for 3 minutes. It will also allow the user to disconnect the patient from the circuit, disrupt the air shower, and alarm silence for one disconnect. At the end of the 3 minutes, the FiO2 will return to the set FiO2. It can also be interrupted by touching and confirming again if the user wants the patient back to the set FiO2 before the end of the 3 minutes. Below the O2 suction button, you'll find manual inspiration/hold. This allows the user to give the patient a manual breath by pressing and releasing. It delivers a breath at the vent settings. This button also functions as an inspiratory hold or sustained inflation. By pressing and holding the button, the ventilator will hold the pressure for as long as the user holds the button down. Notice there's a timer above my finger that shows for how long the inspiratory time lasts, and this will go as long as 40 seconds. Once you release, the ventilator will open the valve and exhalation will occur. Manual disconnect allows the user to set up the ventilator for a disconnect and prevent any shower of air into the room. Simply touch the manual disconnect button and confirm. And as soon as the patient is disconnected from the ventilator circuit, there's no air shower, there's no alarms from the ventilator, and this will last for up to 2 minutes. As soon as the patient is reconnected to the ventilator circuit, the machine regains ventilation at the set parameters. You have a help button in your configure buttons over here that allows you access to the instructions for use. Simply touch the help button, it'll take you to the table of contents, or you can touch index. This will take you to an alphabetized index of all of the functions in the user manual. You can pick a letter, and you can pick any topic, and it will display the instructions on the control panel. Simply touch the X, and that will clear that screen, give you access back to your vent settings, your graphics, and your mode of ventilation. To stop ventilation, you simply touch the Start Standby tab in the lower right-hand corner of the screen. You then touch the standby bar and confirm. Your patient is now not being ventilated and the machine is in standby. You must confirm by touching the alarm reset and using the rotary knob to confirm. And now the patient is not being ventilated, the machine is in standby, and it's ready for use. With all Draeger ventilators, 24-hour a day, 7-day a week clinical support is available by calling ICON Intensive Care Online at 888-404-4266. Your call will be answered by a group of clinicians that will be able to answer the questions that you have. In addition to the clinical support line available 24 hours a day, 7 days a week, you also have access to their website on which you will find ventilator use modules, and that can be found at www.intensivecareonline.com, which is also displayed on the card below.